Good evening. My name is Irfan Khan, and I work with Population Foundation of India as the Associate Director of Family Planning. And I would like to welcome all of you today on this panel discussion titled Addressing Women's and Girls' Needs for Sexual and Reproductive Health and Family Planning Services During COVID and Beyond. And this is on the occasion of the World Population Day. This discussion is part of our conversation series titled Reimagining Family Planning and Sexual Reproductive Health in India, which is sponsored by Bill and Melinda Gates Foundation. Now, you would see on your screen a poll, and may I request all the attendees to kindly enter their responses on the poll. And this poll will remain live for some time. So as and when you get the time, kindly share your responses, and we'll share the results at the end of the webinar. And I also want to inform you that this discussion is being recorded and will be made available to the attendees. And it can also be accessed on the Population Foundation of India's website and its YouTube channel. And, Poonam, if I may hand it over to you. Thank you.
So I'm Poonam Mutreja, Executive Director, Population Foundation of India. Allow me to quickly, in a minute, introduce, for those who don't know Population Foundation of India, we are a 50-year-old national NGO that promotes and advocates for gender-sensitive population issues, health, development, strategies, and policies. And we are the Secretariat for the Advisory Group on Community Action, and we work in 250,000 villages in 24 states to build community awareness in partnership with government to enhance leadership in public accountability on health. Essentially, what we're doing is trying to bring public into public health. And it's a privilege to do that with the government. Holding the government accountable with their support is something that I think in a lifetime opportunity. Our 360-degree approach to social and behavior change communication uses both online and offline tools to transform social change. We all know that recently in India, India has made considerable progress in getting closer to the goals set by Government of India in our national population policies and the global commitments that India has made regarding population and family planning outcomes. One area India can be really proud of. Along with improvements with respect to family planning, India has also made significant progress in reducing maternal mortality and infant mortality, which are both indicators and closely related to family planning outcomes. Along with this, India must do its part as we recover and rebuild in the post-COVID-19 era. It is critical that India sustains overall health, sexual reproductive health, family planning gains, and maintains the gains it has and the momentum and the progress we have achieved. This will require prioritizing investments in sexual reproductive health and family planning, building capacities and strengthening the public health system, which really needs enormous reimagination. Last week, we witnessed the culmination of the Gender Equality Forum in Paris, which commemorated the landmark 1995 Beijing Conference on Women and Development, which I had the privilege to attend. The event brought together government corporations and change makers from around the world to define and announce ambitious investments in policies to accelerate equality, leadership, and opportunities for women and girls to achieve really transformative change for generations to come. We have to address the real needs of all women, men, and young people in family planning by expanding the range of contraceptive choices, methods, and the reach and quality reproductive health information and services within a framework of universal health coverage. We have a great example, which Dr. Sigdar, I'm sure, will talk about, the MPV program in the high fertility districts. With the objective of discussing these and related issues, we have put together a great panel of eminent experts. But before I introduce the panelists, I have a surprise guest. And, you know, it is going to be such a privilege, Kiran, for our community to have you not only hear from you, but have you as part of somebody who we hope will be a partner in enhancing women's sexual reproductive health and rights. I will introduce the panel later, but may I request Kiran to share her views on women's health and family planning in the context of universal health. We have a slide on Kiran's background, but I do want to say that one of the most wonderful things post-COVID, sadly, or during COVID, tragic as it was, has happened is that I had the privilege of being part of the Lancet Commission, which is led, co-chaired by Dr. Kiran Mazumdar, and you can see her background and her achievements cannot be put in one slide, but it is an absolute delight and privilege to have somebody as passionate about public health as Dr. Kiran Mazumdar. Over to you, please.
Thank you, Poonam. Sounds like a mutual admiration society, but let me say how delighted I am to be part of this panel, and thank you for inviting me. And like you, I really got to know you thanks to the Lancet Commission on Reimagining India's Health System. And, you know, I have always been very passionate about health equity in the world. And, you know, as an entrepreneur, actually, I've always worked towards providing affordable access to essential and life-saving medicines that I make. And so with that philosophy, business philosophy, I've been very, very interested to see how we can basically change our health needs and bring about health equity for all. So let's come to this particular panel discussion without losing more time, because this is an area which is also very dear to my heart, because I know the inequities that lie ahead for all of us when it comes to maternal and infant health. And you know that the United Nations SDGs actually puts a lot of emphasis on gender equality and health and economic equity. And as we all know, we are nowhere near that. And as for India, I know that we also have put maternal and infant health outcomes right up there as a sustainable goal. And of course, the pandemic has really delivered a very severe setback to us. But having said that, I think there are some real concerns that we all must be very honest about, because the pandemic has also exposed the inequality that exists in terms of gender inequality and health equity. We've seen that in vaccines around the world. We are seeing that when it comes to how many, the ratio of women versus men being vaccinated and so on and so forth. So let me start by saying that if you look at India's population, we know that about 49% of our population is constituted by women, and there itself shows you the kind of unequal ratio that exists in a country like India. And that becomes even worse when you look at the adolescent population, because girls between the age of 10 to 19 only comprise 47% of our adolescent population. And that roughly equals about 253 million young girls. And when you look at the fertility rate, though, that you're seeing in India today, it is steadily declining, and it has reached a replacement rate of 2.1. But of course, I think when you look at it in the context of India, it is a heterogeneous country. So you are going to see replacement rates varying between states. But nevertheless, to put it into context for the audience, a replacement rate of 2.1 is slightly above Europe's 1.8 and Japan's 1.4, but well below Africa's average of between 4.5 to 5. So when you look at that, you might think, oh, India is in a good place. But when you look at other metrics, I think it tells a very different story. 14% of pregnancies are amongst women between below 20 years of age. 34% of adolescent married girls admit to being physically or sexually assaulted. 50% of adolescent maternal deaths in girls between 15 to 19 years of age occur due to unsafe abortion. When it comes to anemia, that's also a very serious concern because 60% of adolescent women in India are anemic. 85% of adolescent men and women have hardly received any sex education. And 50% of women in India do not use contraception. 30 million married women reported the need for family planning and access to contraceptives. 16% of women beyond the childbearing age suffer from reproductive health problems. And I know when I work in this whole field of cancer, that cervical, ovarian, uterine, and breast cancers are amongst some of the most common diseases that we see amongst women in our country. Gender inequity was reflected during the COVID-19 vaccination program, where as recently as June, statistics showed that 46% of women had access to vaccination as compared to 54% of men. It was also very important to know that during the pandemic, women lost 1.8 times more jobs as compared to men. So you can see that against this backdrop, we are also seeing declining levels of women's health. Domestic violence, by the way, increased a lot during the pandemic. And I'm told that we actually had reported 1.4 million unintended pregnancies during the pandemic. And I'm sure there is a lot of data to show how women's health has declined. So I'm sure you have, great panelists on this show who are going to give you much more, data and rich data about, backing a lot of what we need to talk about. But as someone who's basically a part of, the whole health ecosystem, I can't help but feel that we really need to urgently do things to fix this inequity and inequality that we are seeing in the area of women's health and reproductive health. I know that Lancet had suggested that it is very imperative to include mental health, sexual health, and reproductive health in secondary education. And I think that's extremely important as a starting point. What is also very important is the role that digital technologies and digital health can play in addressing many of these kind of issues that we're talking about. Whether it is about educating the adolescent populations through various ways using digital technologies, whether it is about access to improved sexual and reproductive health care, because I'm sure a lot of that can also be provided through digital healthcare, or whether it is to enable healthcare providers with evidence-based best practices. I think all this can be actually done. And I also believe that digital platforms can capture a lot of more data than we're doing right now to actually tell us what's wrong and how to fix it. Because right now we're looking at a lot of data that is in different silos. I'm sure when you sort of put it into a data lake, and when you actually start looking at that kind of data through different lenses, I'm sure you will find a lot of different kinds of, information, but also possible solutions that can happen by connecting some of these dots. I also believe that as I know that in our, foundation at a corporate level, we have focused a lot on primary healthcare. And I believe that primary healthcare can play a very big role in improving women's and healthcare and reproductive healthcare, because of course, health camps are a very good way of educating young women and young mothers about what is out there and how they need to look after themselves. And I think primary healthcare, we've actually created a large number of digital primary healthcare centers, which is helping us a lot, because you can actually start measuring health indicators of a lot of young pregnant women, take care of them throughout their pregnancy phase. And I think in every one of our primary healthcare centers, we have insisted that we also set up a facility for deliveries, because I think that's extremely important. And of course, we've trained a lot of the healthcare workers to run camps, to go door to door and make sure that women who are pregnant come for regular checkups. And I think we are also focusing a lot on treating anemia, because that is a big issue we find in many, many parts of the country. I think we must strengthen our primary healthcare centers with human resource and infrastructure. And as we all know, nutritional needs of both mothers and infants is so very vital to make sure that the woman is giving birth to a healthy child, and that the child is not going to be stunted whilst growing up, that both the mother and child are well nurtured, so that you actually get healthy babies and healthy mothers. And I think this is something that the Ayushman Bharat Yojana must provide as a basic imperative in its scheme of things. So I just believe that this is a time for all of us to really put a lot of focus on, the health of women, the health of mothers, and the health of infants, because that is what is going to determine the sustainable future of every country. Because whilst some countries are grappling with very, very low replacement rates, India is also getting to that level. And if you don't really address this by making sure that every baby that's born in this country and in the world is healthy and productive and contributing to sustainable development, I think we will be failing ourselves. I think the pandemic has shown up a lot of vulnerabilities and inequalities, and it's really very worrying. Because if you say that men need to be vaccinated ahead of women, and if you feel that men need their jobs more than women, I think we are basically starting with the wrong premise. And therefore, I believe that we need to focus on these goals of sustainability even more than before. In fact, that's what the pandemic has shown all of us, that if you neglect something, it can end up in a huge disaster. That's what the pandemic is. We have neglected healthcare, we have neglected healthcare infrastructure, we have neglected infectious diseases, we have neglected surveillance, we have neglected a whole bunch of things. So I just think that this is a wake-up call for us. And during this wake-up call, it is not just about infectious diseases. It is a wake-up call for us to look at every aspect of healthcare. And certainly maternal and child healthcare is extremely vital for our survival and for our future. So I will end my comments there, Poonam, because I would love to listen to the other panelists. But I think this is such an important topic, and I'm pleased that you invited me for this.
Thank you so much, Kiran. And for the world, this is the best kept secret, that Dr. Kiran Mazumdar-Shaw is not just an industrialist. She is a grassroots. Her work in the primary healthcare centers I've been hearing about after the commission started. She is an activist. She's not only an industrialist. and the passion that I promised you did come out, and we couldn't have had a better opening of the webinar. Then your remarks, the issues you raised, and recommendations and suggestions will greatly guide us. But what is wonderful, I know this community is, and I know I'm going to hear from them also, we have a great ally in you supporting us, raising issues, whether it's sexual health education, whether it's the commitment to invest in primary health, inequity, inequality. And although today's, and I can't suppress my excitement at hearing what you said. Thank you, Kiran. I am now going to go to introduce our 4 panelists. And I'm going to start again. I am not going to introduce, because everybody not only knows them, but I am not going to give their degrees, which are all coming on. They are being put, right? So everybody can read all the wonderful positions Dr. Sikdar has held. But I am going to say that Dr. Sikdar, who I seriously, not in a joke, call him the Tsar of family planning in India, and his contribution, very humble he is, his contribution to the family planning field and the innovations that Dr. Sikdar has brought in, history will record and thank him for. So Dr. Sikdar, thank you very much. And may I ask you, may I put a question to you for your, my staff is telling me that I am failing in my duties, not introducing everybody at the same time. I thought I'd introduce them one by one, but since my staff are my bosses and I have to work with them, I will listen to them. We have with us Argentina Matterwell, who is the resident representative, India and country director, Bhutan United Nations Population Fund. The day I met Argentina, I began to admire her. She is such a well-informed, strong, committed woman with courage. UNFPA has become stronger wherever she has gone in the world, and definitely India too. And we seek advice today from Argentina when we are thinking of programming vision. And Argentina, you may leave India, you've made a huge impact, but I am sure you are going to be available, my friend, to advise us. I know you have fallen passionately in love with India. And of course, the more formal, please read the slide. We want more time to hear from you than talk about the degrees. And then, of course, there is Martin Smith, who is acting director of Family Planning 2030. The interim executive director is the right word, and managing director. Has been working with FP 2020 for, I think, almost 7 years. But what's fantastic about Martin is he's an India hat. He lived in India, married an Indian, had his kids in India, worked on family planning, and then went off to DC. Martin has a great understanding of India, and so we thought, and family planning in India, that we would invite you. And I also want to say that, while we are all in different zones. Martin is in DC and Argentina is in Mozambique. And we, unlucky few are not traveling right now, are hanging out in our abodes. I will now like to introduce a very important person in our work and at the biggest foundation, I call them the big elephant in the development sector. We have with us Archana Vyas, who is Deputy Director, Program Advocacy, Communication, Behavioral Insights. But Archana does much more than that, I know, as though that wasn't enough, but the kind of work she does is just amazing. And she has actually brought huge insights and professionalism and innovation in communication and behavior change amongst And advocacy is something that she does very differently, and we keep learning from her. It is great to have you with us, Archana. And Archana Archana and I also went to the same school. So that's the only reason I mentioned your university. Archana has been a big support, friend of PFIs, and then a donor. Thank you, Archana, for being there. So I'm going to start with Kiran. Look at this Freudian slip. I want to start with you again. With Dr. Sigdar, advisor RCH and FP in Ministry of Health and Family Welfare, with a question: how is India responding to the sexual and reproductive health and family planning needs during COVID-19 and beyond? And there is no one better who can answer that question than Dr. Sigdar for India and even maybe globally. All yours, Dr. Sigdar.
So thank you. Thank you being generous with your, what should I say, all the positives that you talked about. The first thing I would like to say is that everybody on the panel are all good friends, and we've been meeting each other and in talking to each other, have been in communication with each other throughout this pandemic, and it's really been very refreshing. And also today, I think we have a new person in the family, is Dr. Kiran, as you mentioned, that she too really enters this particular family of close friends and becomes close with all of us so that we can all contribute together for the country. Taking the agenda forward, what you started is that, of course, we are meeting here on the eve, rather, of the World Population Day on the 11th of July, when we really give a fillip to the whole family planning movement and population agenda of the country. And we really have it well organized all over the country, which probably people here in Delhi may not know, but it is very well organized across the country. And the feedback that we are getting in our group is absolutely amazing in spite of the physical restrictions that we have. At the outset, with all the gratitude, I'd like to acknowledge the monumental contribution of our medical fraternity, including professional bodies, in the fight against COVID. And my best wishes are with them and their families in these trying times. Kiran actually mentioned and rather reeled off data after data, plenty of them, whether it was survey data or some data probably which has been derived from modeling. Some of the modeling data may not be the actual data, may not reflect the actual situation on the ground. But otherwise, we as government are not really wishing away those data, because we feel that we have to know what is really on the ground, and only if you know what is the realistic picture, only then we can have our programs in place to really tackle all those issues. I just want to start with some positivity in the sense that whatever data was reeled out, many of the data have really improved over the course of the last 3 NFHS surveys, last 4 rather. And the data which is coming in from the National Family Health Survey 5 are very, very promising data, very, very good data, which is really reflecting things that are changing very fast across the country. And that is something to celebrate about, but we cannot really stop there. We really need to continue to work till the time that we really remove those inequities that she talked about, because we are also concerned about that, and many of the times we are also ashamed of some of the data which really should not be there in the first place. Together we have been fighting the battle for COVID pandemic, and I must compliment the indispensable support and the successful collaborations of all development partners, including you, Poonam, and the civil society organization in supporting the public health systems for delivering essential health services. And we have really worked as a team. I mean, whether inside the government or outside the government, we have never really worked at cross purposes. And that has been the positivity in the ministry. Leave aside the data, leave aside the other things which come up in the social media. But I think back in the ministry, things are very cohesive and very cooperative atmosphere is there. People are focused on their job, and people are not really diverted by all the things in the social media, what is happening around. And we are really at a crucial juncture in our combat against the COVID-19. As the daily reports that you have been seeing is now around 40,000. But then there are certain districts where the numbers are still not coming down. It's a cause of concern. There are regional variations. And having suffered this deadly second wave that overwhelmed the country, we hope that the slipping numbers do not lead to a flawed sense of comfort. This is something what everybody should be afraid of, because there is a sense of comfort in many states of the country, including in Delhi. That is something which we need to be aware of and beware of, because unless and if we really lose our guards now, or let down our guards now, I think that maybe we can be in for a third wave. That is something it is a responsibility, I think, on each and every one of us. While currently substantial energy in the country is focused on controlling the transmission and curtailing the morbidity and mortality due to the pandemic, we are also mindful of the fact that essential services should not be compromised. Right at the outset of this pandemic, the government of India was very, very proactive. And in the month of April only last year, we shot letters and in fact talked to every state government, said, come what may, irrespective of the COVID status, the essential services should be denied based on the categorization which was arrived at that now. Things have really smoothened out much more. The services have been restored to a large extent, and our data which is coming out from the state is that many of the places it has become life as usual, and the services have been restored almost fully. Considering the fact that the sexual and reproductive health services that we are talking about today are often the first casualty in the midst of any emergency, the continuation of the services has been and will always be the primary agenda of the government. And this continuation is important, not only to maintain the people's trust in the health system, but also to minimize an increase in morbidity and mortality from the health conditions. For India, the cost of non-ability of services and commodities is humongous, with more than 2.5 crore pregnancies each year. And I know for sure that there has been some data which shows probably there were pregnancies that really happened, and many of the pregnancies have come down, so the home deliveries have gone up. The data that we have got from the states, and they are quite reliable data, is that we actually have not lost many of the deliveries, and the home deliveries too has been bare minimum. It has been only 1% or 0.1%. Hardly has there been an increase. And we already have had 3 rounds of reviews with the states, one by one. And we found that we have suffered in services, but we have not suffered to the extent that we thought we will or we were afraid of. So that's the reason why we feel a little bit better off now in terms of the stabilization of the services. The sexual reproductive health services are not only a crucial part of the healthcare, but they also constitute an essential element for achieving the gender equality and promoting women's rights. And we in the government are very much conscious about that fact. And Poonam will be happy to know that we work in that arena. We may not shout from the rooftops, but the fact of the matter is that that is very much there on our agenda right at the top. Because it really gives women the option to make autonomous decisions about their own bodies and sexuality. This keep women healthy, dignified, and safe. It is also important to recognize that reproductive health issues may not be restricted to women only, because that of men may also suffer consequences. Ensuring access to sexual and reproductive health, both for men and women, is fundamental to reducing maternal and neonatal mortality, increasing equality, and reducing poverty. Kiran mentioned about the awareness about, or rather the information about the sexual and reproductive health service is deficient in the women. Actually, it is equally as deficient, in fact, more deficient in the men. So it's men as a community cannot be really ignored if we really want to address the issue of gender inequity and inequality in a holistic way. The key focus of the Rms services include services related to the pregnancy care, the management, the newborn care, and the childhood illnesses management, immunization services, management of SAM children, family planning services, comprehensive abortion care services, and adolescent health services. The whole gamut of services, which are all very, very essential, which we have been able to manage to provide throughout this pandemic, at least if not immediately in the month of March, April, or May, but from June onwards, the services had been by and large restored. We have also provided a comprehensive guidance to states for continuation of essential services, and it is expected that the rapidly increasing demand on health facilities and healthcare workers leaves the health systems overstretched. And the government of India is therefore focusing on provision of alternate mechanism for delivering essential services. And Kiran mentioned about the the digital support that we can really take advantage of, and the e-modules that we can take advantage of. And that is one area where really we have moved in the fifth gear. We are harnessing the use of technology and opening up telemedicine through transparent guidelines, which is actually improving the access to healthcare even in remote locations. The telemedicine practice guidelines is enabling registered medical practitioners to provide healthcare in very, very extreme remote settings. This is to ensure that faster access to the appropriate interventions and services that may not otherwise be available. Government's e-Sanjeevani portal, which has come out as a unique portal, which is a national teleconsultation service, is one of the innovations which excelled during COVID-19 and still excelling. You'd be surprised that we have got 21,000 doctors registered on this particular portal, and we already have provided 71 lakhs or 7 million OPD consultations, including RMS services. Add to that, the state governments have their own portals, so they have not really, sitting idle. They have developed their own portal for teleconsultation. So I'm just talking of the national portal hits about 71 lakhs OPD consultations conducted, of which around 50% have been, 60% have been conducted over the last 2 months. In order to provide the quality services and improve access, the capacity building of providers is also being done through the online modules. We in the family planning division have developed online modules for injectable contraceptives and oral contraceptive pills. And also we already have short letters to the state governments that this is something is going to be put on the website by Monday, and we are mailing it today itself to commemorate the World Population Day, which is due for the 11th of July. An important cornerstone in our journey towards leaving no one behind in family planning is marked by FP 2020. Martin is here. I'm actually older than Martin in FP 2020. I must take that privilege. But the fact is that Martin is now leading the show and is moving on to the FP 2030 bandwagon now. This really provided the much needed impetus to the national agenda of protecting children and mothers through improving access to family planning choices. India became an important member of this global community or family to address the policy, financing, delivery, and socio-cultural barriers to women accessing contraceptive information, services, and supplies. During this last 8 years, before we are moving on to the 2030 bandwagon, we as a country have added more than 15 million additional users for modern contraceptives, thereby increasing the modern contraceptive use to 55% as per Track 20 estimate. And the total allocation for family planning during this period was to the tune of $3 billion US. With all the information that is coming up through the NFHS 5, the first phase 22 states, and also the data which is coming up for the rest of the states, there are very good news for family planning. That number is going to be substantially higher, and the number of additional users will increase almost double than what we have already done. So the overall effort is a success story which is driven by political will and strengthened by improved governance, provision of finances, meticulous planning, implementation and effective monitoring and learnings. And during this short span of time, what we did was we added 2 new contraceptives and really good contraceptives, the injectable MPA and the Sencromen in the National Contraceptive Basket. And it was really a proud moment for us because the Sencromen is an indigenous product of India, which is now getting national as well as international recognition. There are demands from certain countries to really use this. So this is something of good learning as well as an experiment which is really succeeded. Though the high-level political will, through the high-level political will, which Poonam just talked about, we started the high fertility approach under the Mission Parivar Vikas in 2016. And we really gave impetus to the program in line with the vision of the Digital India and the FP Logistics Management Information System to ensure commodity to the last mile, as well as the 360-degree media campaign. It covered all aspects of the IEC and BCC, and this is how demand generation was achieved.
Dr. Siddhar, you froze. So you said 360-degree and then we couldn't hear you.
Can you hear me now?
Yes. So when you said 360-degree, we lost you. So if you can continue with, we love the 360-degree approach. So we want to hear you.
So the 360-degree was the last thing I uttered, so you haven't missed anything, don't worry. And Archana is sitting in front of me. We have been partners in crime. I don't know how many sessions we had between Archana's team and our team. In fact, I think thrice a week we would sit together, talk about all the storyboards, and then finalizing the draft, and then going for shooting. And this is something we really achieved together in a collaborative mode with all our partners. So that is something that we really are very proud that we as a country work together. And in fact, strengthening the post-pregnancy contraception with more than 10 million pregnant women benefiting through the postpartum ICT program was again and really outlier. It really improved the quality of our program, and this has become the central tenet of the program. And the recent National Family Health Survey actually substantiates the effort. So I'll just officially can give you this data for the 22 states. Unofficial data for the rest of the states are actually right now have not been approved. So it will not be right on our part to talk about that. But out of the 22 states for which the data is out, so 21 of those 22 states actually showed an increase in modern contraceptive use. And it was just not increase, it was quite substantial increase. And 20 out of the 22 states actually shown a decline in unmet need, which again was considerable and something of music to our ear. And last but not the least is 19 out of the 22 states showed a decline in total fertility. Only one of, and the 20th state showed this thing, the continuation of the same red. There was only 2 states where there was a marginal increase, but then that was, I think, it's in the state of Kerala. But that it doesn't matter for a state of Kerala because it is already at a very low level. We have thus achieved an impressive decline in fertility, and maternal mortality too has declined substantially. We all agree that in this testing times, as governments, ministries of health, and frontline providers, we were forced to make tough choices about which services are most important. Still, there has been an effort to address the SRH needs with numerous state-level innovations. The pandemic may slow down our pace, but won't stop our enthusiasm and untiring efforts to address the SRH issues, which is high on the agenda. So as the government is embarking upon the journey of universal reproductive health care, a collaborative approach is prerequisite to that success, and we are committed to Western new challenges and envisage assuring family services for all. And in this endeavor, everyone has a role to play. It is important to remember that our joint efforts are needed to meet the SRH needs of our eligible couples, but as it is with every endeavor for the people, it can never happen without the people. Hence, I urge all stakeholders to get together and make concerted efforts with solidarity and compassion. And thank you, Poonam, for this opportunity. And thank you also, Argentina. I didn't mention you, a good friend of mine, an old friend of mine, and I'll be one of the saddest person to see you go. So over to you, Poonam, back to you.
Thank you, Dr. Siddharth. Thank you for, always sharing the great progress we have made and what is being done and what needs to be done. And you're absolutely, we must add when you say that, yes, the government did its best and did send out a mail saying essential health services must be continued. But let's also remember when we say services went down, that people, whichever class, poor or rich, are today scared to go to both public health and private health facilities. We have to factor that in. None of us will go today, even for urgent needs, to the health facilities. Why will poor people risk their lives going to public health facilities? I'm not saying nobody's going, but I'm saying we have to factor that in. And, even today, as we speak, there is a new policy being announced in UP for population, and a lot of the innovations that have been done in the last 5-7 years, especially from Mission Parivar, are going to be included. We are, the success of the enormous hard work. Yes, partners worked with you, but Dr. Siddharth, you really led the family planning program so effectively, and we all love working with you. And also, what is wonderful about Dr. Siddharth is you can disagree with him, and he still respects and works with you. And as he said, whatever the social media, the collaboration in the health ministry and especially on the family program has been, a family planning program has been like a family, and all of us working together. And it's been an absolute pleasure. And I hope that will continue in the years to come. I am now, you mentioned FP 2020, and there are two panelists here, Argentina from UNFPA and Archana from Gates Foundation, that have co-chaired and led the initiation of FP 2020. And so it is very, and the government of India has been a key player. And if I may add, I had the privilege of being a reference group member when it started, and being with our additional secretary when FP 2020 was formed in England. And I am very proud of the role that India has played in meeting its commitments. I am going to come to you, Archana, with a question. We all have seen and read and heard of instances of stigma and violence against COVID warriors. And I know what role you have played with Niti Aayog, Health Ministry, and others. We've also witnessed fear-mongering and fake news over social media channels and so on and so forth. In a number of dipstick surveys across states in India, Population Foundation of India has found that there are common misconceptions amongst women about vaccines that relate to the effect on their fertility, safety for pregnancy, lactating women, leading to COVID vaccine hesitancy. How would you describe the relevance of effective communication, SBCC strategies to respond to these issues as they relate to women and also to the population as a whole?
So thanks a lot, Poonam.
And say more. But this question, I couldn't stop from asking, when you have so much experience, when an expert, but tell us more. I mean, this is a question that I had to pose.
So thank you so much, Poonam, first of all, for having me on the panel, but also with all the partners who we work very closely. So, and this is a momentous occasion, World Population Day. It is important to put urgency behind family planning. We are working in a COVID scenario where we do think that health services have taken a setback, and even reproductive and maternal and child health would have taken a setback. It's really important to put as countries are thinking about rebuilding, as countries are thinking about restarting or kickstarting. It's important for women to be put at the center, as well as putting more emphasis behind family planning because of so many issues that Dr. Sikdar has spoken about, Dr. Kiran Majumdar-Shaw has spoken about. Now, coming to the issue of misdisinformation, Poonam, that you spoke about, we know that even when it came to pregnant women and lactating mothers, there was a lot of issue when it came to COVID-19 vaccines, right? Because the women were fearing whether they could take it. There's so much of fear mongering. There are so many.
1 minute. I just want to tell you that there is some there is some disturbance in your system, microphone.
Okay. Maybe, should I just put on my video and try once? Because I have been facing some challenges.
Okay.
Is this better?
Yes.
Is this better? Is it better or no?
Speak a little more, then we'll know, na?
Okay. So even during COVID-19, is it better now?
No. Archana.
So I'll tell you what, why don't we switch to someone else right now, and I'll come back.
Okay, while you fix this. Okay. Okay.
Room.
Absolutely. I will definitely do that. So may I come to you, Argentina? Argentina, may I come to you? Lovely to see you. Given that COVID-19 is probably not the last pandemic to impact the world, what lessons can India draw from the crisis? How can we plan better to ensure continuity of essential family planning health services during similar future emergencies, pandemics? Do you think availability of self-care models will help? I've asked you a lot of questions in one question. I hope that is okay with you. And given your experience globally, and I know how you keep up with the world, even when you are focusing, while you are focusing on India, I know you have your eye on the world. So I ask you these questions that will help us from global experiences too. Thank you. Over to you.
Thank you very, very much, Poonam. And of course, echoing all the two previous speakers, or the three rather, on thanking you and PFI for always being such a leader and a great friend of all issues population, especially women and girls. And because this year, understandably, the Ministry of Health, which has the ICPD under its mandate, will not be hosting any event. We are very, very thankful that you would organize this. And I really am thankful to be here, because I know I will learn from the distinguished speakers that you, as usual, managed to put together. That's one of your great assets and skills, is to bring us together and bring the best, actually. So I know that this conversation, of course, it's not a 1 hour or 2 hour conversation, but nonetheless, I wanted to start by reminding us of this year's World Population Day theme, which you framed the discussion around, which is really focusing on rights and choices for all, but prioritizing, putting the importance of prioritizing reproductive health and rights for all people, most especially women and girls. Even though I heard you, Dr. Sikder, that men and boys are important in this discussion and dynamic of sexual reproductive health. But we know, of course, that women and girls bear the brunt of, any challenges in this sector. And just before the World Population Day, we also need to recall the State of the World Population report, which comes every year with an important theme. And this year was focusing on bodily autonomy. And there is no bodily autonomy for women and girls unless they have access, continued access to sexual and reproductive health, and especially family planning and maternal health. Which then, of course, influences and is influenced by the whole issue of gender norms, social norms, and gender dynamics, which is why my article on the paper this year on this occasion speaks and addresses and reminds us of the need for this generation to address whatever is negative in the social norms that their society has. We all inherit social norms, which are great to ground us and to, identify us as a people. But of course, as we develop, there are some norms that then become almost an obstacle to our growth. And so I call upon this young generation of today to be bold enough to look into those that are negative and address them. So having said that, back to your question, Poonam, you wanted to know, given that this is not, unfortunately, the last pandemic, what can we learn? The beauty of human beings, and I think even other live beings, is that when cornered in crisis or danger, we come up with innovation. We come up with innovative ways of, coming out of whatever situation. And this pandemic has also taught us and shown us that we were able to very quickly, perhaps for some not quick enough, but let's recognize that there were very good initiatives to come up with alternative ways, for example, of providing, and I'll focus on family planning and sexual and reproductive health, especially maternal health and family planning. That's my focus for today. So I think the alternatives that we found were that, number one, we quickly, for example, we're able to task shift, as Dr. Sikta was talking about, injectables, for example. Frontline workers were able to, with support from doctors, through telemedicine, through just a phone call, a mobile phone, guided by the medical doctors, to provide that injectable to the client at their home, closer to their home. We learned that it's important that most services be provided closer to the homes. We need to continue exploring and scaling up those. For example, in Odisha, the government quickly turned to postal services, to providing the supplies for family planning. That had an enormous positive impact because the other modes had suddenly become unavailable. In Bihar, for example, there was a project called We Care, that, partnering with the health department, using cell phones, pregnant women close to in their last trimester were able to be tracked and then be provided with mobile services immediately, regardless of what level they are in. And this was most notable among, for example, the street cleaners, those who had lower income. And in Rajasthan, for example, the ANMs, and that's what I was talking about, the Antara injectable. The telemedicine, perhaps it was already there, but not maximized. And I don't think we have maximized it yet. So it will be important that we explore modes of scaling up the use of telemedicines, because we know that midwives or nurse midwives can provide up to 80% of all services that women and girls need, sexual and reproductive health. That's what the International Confederation of Midwives tells us, that well-trained nurse midwives could do that. But it's important that that many of the services be allowed for them to provide, as opposed to medicalized and putting more services on doctors. I mean, based on WHO estimates, 15% only of all pregnancies will need a very highly trained doctor, which is, the emergency obstetric care, the higher level emergency obstetric care. So that means that 85% can be done by nurse midwives. So by that task shifting, and because usually nurse midwives are women, they are closer to the patient, to the clients, they are willing to live closer to the clients. I think we need to maximize their services and put them, allow them and explore and scale up. And I want to take the opportunity, of course, to commend the recent, it's not so recent, it's already 2 years or 3 that the government decided that they would professionalize midwifery. But unfortunately, with the COVID, we have stalled, we have delayed. Otherwise, we would by now probably be having the first batch or close to having the.
Oh, we have a freeze. Let's see if she can come back very quickly. Otherwise, I know, Archana, you have a hard stop. We'll come to you. Let's go to Archana and can someone send a message to Argentina? And then, of course, we're going to come to you, Martin.
I think she's come back. Poonam, okay. I can stay for longer. No problem. Yeah.
But I was on the home stretch of that response. So in other words, I think this is the time for innovation. This is the time for using technology. India is lauded around the world for being on the cutting edge of technology. This is the time to bring it to health and to serve the most underserved, especially women and girls who are in the remote areas, those in the lowest income quintile, because they are usually the most left behind. And I think this decade of action, as the Secretary General calls it, the 8-9 years that we're left with to 2030, this is the time for acceleration. And acceleration means using our technology, maximizing all the solutions that were used still in a patchy way to bring services closer to home. Over to you, Poonam. Thank you.
Thank you, Argentina. I couldn't agree with you more, and it's great to hear your perspective, and I hope we'll have time to come back to a second question on your experiences in India. So let me go to Archana. Archana, would you like me to reread?
No. That's fine.
Okay.
I know that we were speaking about misinformation, so I'm going to pick up from where
Archana, we had a second question, and given the way the time is going, and you may not be there for the second question, can I also read my second question to you so you can include it, or am I overburdening you?
No, that's perfectly fine. You can read the second question, and I'll try and answer both these together.
Okay. So second question is, considering the digital divide in India, especially in the rural areas, how can we harness future digital technologies for health information and also for service delivery? And what will we have as some of the challenges in doing that, and what do you foresee in challenges you see in adopting technologies? Because it's not so simple, right? To make positive and sustainable change in family planning interventions, especially, and that's something you've looked at, worked on, and so on. So I'm adding a whole, this is called a bouquet of questions. This is my bouquet to you.
Thanks a lot, Poonam. And I think both the questions are related, right? So
Yes.
is a pandemic in itself. Most of it has been caused because of digital access, right? The reality is people are accessing information on digital, and they trust the information that is going on digital channels. Not to say that the information that is going on, all the information that's going on digital channels is inaccurate, but the fact is that there is inaccurate information that floats out. We look at WhatsApp, we consume WhatsApp, we look at it as almost like this is the gospel of truth. It's become a news channel, unfortunately, not necessarily realizing what's the fact and what's the science behind the information that is coming forward. This misinformation or inaccurate information actually impacts all of the public health program. While we are seeing it as an accentuated issue right now during COVID, but the fact is that even on family planning, even on tuberculosis, even on other diseases, the fact is that people do not, and anemia, right? You have inaccurate information and not necessarily, or there are fears, there's myth, there is, half information, and people are not obviously adopting those public health services and those provisions. In terms of the strategies, I think the good thing about COVID is that, what Argentina has spoken about, what even Dr. Kiran, Dr. Sikdar have spoken about, is that there have been mammoth innovations in a short period of time, whether it's vaccine manufacturing, whether it is about surveillance, diagnosis, treatment, tracing. Every country, and especially it's phenomenal for India that we've seen such a rapid pace of innovation and acceptance. And I think that those lessons can be learned for public health. We've spoken about, while we speak about digital divide, look at all the platforms, whether it's Arogya Setu, whether it's CoWIN, Dr. Sikdar spoke about Sanjeevani platform, e-Sanjeevani platforms, right? Now, these can easily be replicated for public health, because what are they doing? They're actually tracing, they're diagnosing, there is surveillance, there is teleconsultation that is being provided, and these tools can. India is on an accelerated path when it comes to digital adoption. So at one end we talk about digital divide, and I will speak to that as well. But at the same time, one has to recognize the accelerated path of digital access as well, and therefore to the remotest people. Today, teleconsultation is possible, right? Remotest locations, because reality is that we have shortage of we have shortages of doctors. We have also shortages of supply. E-pharma has come to bridge that gap as well. So I think innovation is really the accelerated pace of innovation, the accelerated access to digital platforms will provide good pathway forward for public health as well. In terms of digital divide, well, even on COVID, it was recognized, and therefore walk-in registrations were allowed, right? There'll always be a parallel structure. So if vaccination centers are few, and also in some cases, they were also criticized in terms of, are they breeding COVID infections as well? Vaccination camps are being put out in places like Bihar and UP. So I think the government also is a fast learner. You do recognize the challenge and you quickly correct for it, because access is going to be super important. So my big message when it comes to digital divide is that there will always be a parallel system which is more realistic. The government all governments have been fast learners, and especially LMIC governments like ourselves, we've shown rapid scale of innovation. We've shown rapid scale of adoption. And hopefully that will not reverse back. I mean, I have great faith that as we think about rebuilding strategies, what we've learned, we won't unlearn, right? We will only take it forward. And that's the spirit of India. As Indian, I can tell you that's the spirit. We always move forward. And coming to your question around misinformation, look at what you did. You supported MyGov with the chatbot, right? Or the work that Ministry of Health has done in terms of partnerships with platforms like Google, with platforms like Facebook, with other platforms like Twitter, is to make sure that accurate information is being made available to people so that they can make their own decisions. Vaccines are voluntary, right? We want more and more people to take those vaccines, but the fact is that these are voluntary. They should have accurate information so that people can make right choices, right? So one is making sure in terms of strategies, and there I again broad-based, even for public health, provide accurate information to people in a way that they can understand it, because it is also mental makeup. You're also trying to find barriers in a way it seems intuitive to them so that they can make the right choices. And India has had a science-based response. We've relied a lot on technical experts. We've relied a lot on technical voices. That's the right thing to do. I think in COVID, the science-based response that India has taken is very good. So first of all, get accurate information out. That's how you tackle misinformation. And, and research from Google actually tells us that Ministry of Health is the most looked after and sought after site. And therefore, if the searches were around 500,000, they've gone to more than 7 to 8 million, right? Because people are looking for that kind of information. So it's really important that Ministry of Health therefore took the charge. They're providing information every day. They're holding out press briefings. They're providing facts every day to people. You have the chatbot going, which is like a two-way interaction. Then you provide accurate information. That's phenomenal, right? So first of all, I would say in terms of strategies is accurate information in a way that it sounds intuitive to people. The second thing that I would say is people don't only rely on science, they rely on people like you and me, right? I would trust Poonam because she's taken a vaccine, or I would trust Martin because he's taken a vaccine because he's telling me that he's not fallen sick, right? The social influence is a huge, huge, huge strategy that is really important when it comes to public health, even in terms of, again, going back to family planning, I would trust in terms of making the choices for contraception that perhaps my sister-in-law has taken, right? This social influence is because you trust either a religious leader, panchayat leader, you trust your school teacher, you trust your family, you trust your friends. So therefore, empower people and their close networks to have the right information so that they can provide the right advice. That's really important. So the power of social influence is really important. The third thing that I would say is role of media across all our programs. And Poonam, you work extensively with media, making sure that they have the right kind of information so that they report out responsibly. They, fact checking has been heightened by media houses during COVID, but also otherwise for all public health programs. Giving out more priority to public health programs for reporting. Don't sensationalize. Go behind what is the right kind of reporting, right? That's something that you work really hard upon. That's close to our heart as well. That's again, super important. Fourth, I would say fourth strategy is for people to be responsible. It's hard. I mean, I forward out messages that might not be accurate, but there is responsibility of people, especially during pandemic, it becomes heightened, right? That you have to act responsibly, that you're not passing on wrong information because people's lives is at stake. To that extent, they are an equal participant. But again, to conclude, I think innovation, a digital divide is there, but I have great faith in accelerated pace of digital access. Divide, we'll have to go off strategy. I mean, in the sense of digital strategy, the offline strategies will continue to innovate there, right? And the network of civil society partners, implementation partners becomes extremely important, so that access, the bridge to access is shortened, and you can get people the provisions. But in terms of the digital information, curtailing misinformation, accurate information, social influence, understanding barriers and motivation of people, and making sure that the information is related so that they get motivated, rather than you're just saying, science facts, but also it motivates people. And I would say role of media would be the strategies that I'd recommend. Thanks a lot, Poonam.
Great, Archana. I mean, this is a 101 in what we need to do in behavior change using technology and changing social norms, which has, you will agree, become the most important issue in the health system, not just in other areas. And, on the digital divide, my position, and my position I want to say is, yes, there are fewer girls and poorer people have less access. But if you look at the numbers who have access, let's try and reach them at least, and not make digital divide the excuse not to reach out to those women and poor we can. And so this is great. Thank you, Archana, and thank you for extending your time here. I'm very grateful to you. I'm now going to go to Martin Smith, the FP 2020 that has become FP 2030 now. And Martin, well, I'm going to ask you a question which doesn't say, tell us what is going to be in FP 2030, but I hope you'll slip it in. And I know you have, you're smart enough to do that. And I'll put both my questions together. I'll give you the same bouquet of flowers that I gave, bouquet of questions, sorry, I gave Archana. So I'm going to give you two questions, if I may. FP 2020 is currently working with its member countries, including, of course, India, to frame their commitments, priorities for the next 10 years, or is it less years? I assume it's 10 years because that's what it was last time. How is India addressing its pressing priorities and preparing better to meet its commitments? How has COVID-19 shaped, or should we say reshaped, FP 2030 countries and the commitments? And my second question to you, and since we are short of time, I'm going to request you to combine it. We are not going to have a second round, which is, could you tell us how are other countries responding to COVID-19, COVID-related stress on family planning services? I would say give equal attention to this. Sigdar and many other people, including me, have talked a lot about India. And so you choose how you want to use your time. You are normally, there are fewer women on every panel. They're mostly men, and a woman is token, but I can tell you, you're not here as a token man. You're here for all the experience and information and the great work you have done in FP 2020. Thank you, Martin.
Thanks. Thank you so much, Poonam. It's wonderful to be with you and the fellow panelists today. So FP 2030, as you mentioned, was launched in January of this year of 2021. And we're currently working with over 50 country governments, including the government of India, on their commitments. And we're very fortunate to have Dr. Sikdar as part of our current governance body, our transition oversight group that is guiding the work of FP 2030 in this transitional year. And several people have said to me, well, isn't it very unfortunate, Martin, in many ways, that the year of commitment making to FP 2030 comes at the time of COVID and all the stresses and strains and difficulties and attention quite rightly elsewhere. Isn't that difficult for you and the team, Martin? And as I ponder on that point, my response is very clearly, what better time? What better time to be talking about our next round of family planning commitments, a time when we are really at the heart of the spirit of innovation that we've heard about from Archana, from Dr. Sikta, from Argentina. What better time when we're bringing into even sharper focus than ever before the equity issues that lie before us, the great points that were made in the Generation Equality Forum last week. What better time to be setting out our FP 2030 commitments globally than a time when we really understand the fragility of our health systems and how our FP 2030 commitments really do need to focus in on the robust foundations and the ability to respond to crises that they need to really focus upon. So we are meeting countries where they are in their current situation. So for some countries, that means putting a pause on their FP 2030 commitment process while they deal with the COVID situations. For others, it means a pretty normal process. And for India, I would say that the conversation has continued. And I'd like to pay tribute to the resilience, to the innovation, to the incredible work of our broader public health community in India and our FP 2020, FP 2030 focal points, specifically for continuing on the commitment conversation through this period of time, ensuring that family planning remains an essential service and yet focusing on the key strategy for the future as we do that. And of course, our FP 2030 commitment conversation for India should focus in on what's been brilliant, what's been so successful about the FP 2020 era. As we've heard from Dr. Sikta and others, the important expansion of method choice, the amazing domestic financing of family planning, the key reliance on data-driven decision-making and the very encouraging data that we're getting out of NFHS 5, including many of those key metrics, demand satisfied up at the SDG benchmark for the first time in the last couple of years. And so we're now moving into the FP 2030 commitment process. It's great to be working with Dr. Sikta and the Government of India team, with Argentina and the UNFPA team, with you, Poonam, as our civil society focal point as part of the FP 2030 focal point structure, with the YP Foundation and the youth partners, and then other colleagues, including USAID, Packard, and indeed BMGF, Medha and Archana and colleagues. And that group really making sure that they include and engage with our broader family planning community to come up with the best possible FP 2030 commitment over the next few months. What I would say is that there are some key areas that from my perch, having worked in India and having had the privilege of working so closely with colleagues over the last few years, that I would suggest may feature in commitment conversations. Firstly would be that point on method choice. It was incredible to see that commitment to increasing the basket of contraceptives in the public sector. I do hope that the next commitment takes that progress and takes it further, including the very important point that Argentina made around task shifting, which is critical. I'd personally like to see a focus on the private sector. Private sector delivers such a sizable proportion of health services, about a quarter of all health services, as I understand it in India. There is huge potential to be tapped there in the right way. And I do hope the next commitment really focuses on the role of the private sector. I hope the next commitment focuses in on adolescents and young people, this huge, probably the largest in the world cohort of young people and adolescents. The review, as I understand it, of the RKSK program, and taking all of that learning into a really robust commitment around adolescents and young people would be another area. As Argentina and Archana and others have said, having a commitment in there that really focuses on what's been excellent in the response to the COVID pandemic and taking that into some thinking around emergency preparedness, response and resilience would be another area that I'd suggest to focus upon. And what we're suggesting to all countries is that the accountability mechanism should be in place from the outset as the commitment is made, and that great sort of interplay between the government and civil society, that we see in this forum and we see throughout India should really be central to the accountability mechanism that's set out. Moving on to your second point very quickly, Poonam, in terms of what we're learning from other countries in the pandemic. Well, in Ethiopia, the Philippines, and many other countries, that use of digital platforms that Argentina, Dr. Sikter and others have mentioned has accelerated significantly. Facebook, WhatsApp, SMS, AI chatbots, as Archana was saying in the India context, also in Ethiopia, Philippines, radio coming back into play as a key medium of getting really important public health and family planning messages out there. And in Ethiopia, specific family planning messages for young people developed by youth designers, a very, very important piece here. In Kenya, faith leaders spreading family planning information via household visits door to door due to the closure of faith houses, which is the usual medium for messages in that country. In Madagascar, advocacy to the Ministry of Public Health for the continuation of FP services and an adapted service delivery mechanism, raising the awareness of providers about the need to encourage users to adopt long-acting methods if they so choose, and if they would like a short-term method, allowing providers to give those contraceptives to cover several months of cycles so that return visits don't have to happen until times have returned to a more normal setting. Some of those sort of responses to lowered demand, I would say. Then in terms of supply chain, lots of great innovation. Nepal and Zambia, government and FP providers shifted stock to more remote areas to ensure sufficient supplies would last for months. A lot of countries have been doing this in pre-positioning stock to overcome some of those supply chain disruptions that have been a feature of COVID for the last 16 months or so. In DRC, Pathfinder and the Ministry of Health with the private sector NGO implementing partners launched training for central government colleagues and NGO providers on the self-injection of DMPASC, and self-care methods like DMPASC have really come into their own during the pandemic times. And to comply with COVID-19 travel and gathering restrictions in DRC, small group training sessions have been adopted, distance training through teleconferences and on-site training in some cases. In Kenya, quality assessments for private providers that are linked in as part of these social franchising and other networks have been conducted virtually, which I think is a fascinating innovation. Poonam, if it's okay, I would just like to say a couple of words on data. Please. If I have 2 more minutes. Thank you so much. So, of course, one of the key things that we should focus upon is that data systems just haven't been spared from the impacts of COVID, and surveys are one of our most important sources of data on family planning progress across the globe, and many have been suspended during this period. And obviously NFHS 5, the second round beyond the 22 states and territories that Dr. Sikter mentioned, has been an example here. But in most cases globally, those surveys are yet to resume, and we're probably going to face a bit of an information gap globally on family planning progress of 2020 and 2021 in the absence of having all that survey data coming through from DHS and MICS and so forth. Routine data systems therefore become even more important in the absence of that survey data. Monthly data from HMIS systems is really helping us understand these disruptions as close to real time as we possibly can. And so in last year's progress report published in November, we were able to examine service statistics from private sector partners like Murray Stopes, as well as HMIS data from many countries, Cameroon, Liberia, and Nepal, to assess the early impacts. And MSI's data really illustrated the quick response of the family planning community, and that's mirrored across the world, I think, and showed that some of our early fears of a complete disruption to services were largely avoided. The HMIS data showed some worrying signs, such as variable impacts across countries, different methods and time periods, depending on the different waves of the virus. And so inherently, our focus on HMIS needs to increase and improve during this time. Our lags in the economic data are also apparent. So it's a challenge to get the financing data together on the impacts of the pandemic. In 2021, we'll be capturing financing data, but that will be from 2019 as far as domestic financing contributions to family planning is concerned. So still before the pandemic. So there is a long runway for us to truly understand the financial impact of the pandemic, both in terms of domestic expenditures and in terms of donor expenditures as well. So I hope that gets to 2 or 3 of your questions, Poonam. Back to you, and looking forward to the rest of the
Great,
session.
Martin. You really know how to use time and capture so many points so brilliantly. And while you were talking, I have to say that Priya Emnet had multiple approaches she shared with us that other countries have tried. And so thank you so much, Martin. This was really, really helpful. I'm sure people want to know more about FP 2030, and perhaps we can have a session in the very near future on how not only India is going to function as part of FP 2030 in terms of our programming, but also globally, what is happening and what is going to be the new architecture. So really, really great.
Very happy to do that. Yeah.
Yeah. Now, there is, I want to say that every time we do a webinar for 1 hour, and we thought, because we respect your time, then it wasn't enough. So we did 1.5 hours today. It's not enough. I am really sad but delighted and encouraged that 3 of our advisory council members, 2 leading demographers, Dr. Arvind Pandey, Dr. Leela Vasaria, and Sumita Mittal, they're all on our advisory council, which really determines our policies and programs. There are of PFI. They are online, and we have Shireen Jijiboy, of course, India's most favorite demographer, and she's also, we have the privilege of having Dr. Shireen Jijiboy on our board. We have 4 of them and several other people who we will not have the privilege from even commenting or seeking a question, given that we have again, we aren't left with time. But there is one question, there are many questions, and I promise those who have put questions in the chat box and comments, we will respond to you. But there is one question that I believe is very important, that an anonymous participant, how do we get an anonymous participant? I don't know, but when I saw the chat line, the Q&A, I found an anonymous person is there who's asking this question the question is for UNFPA, BMGF, and FP 2030. Thank God it's not for PFI. The Uttar Pradesh State Law Commission has begun the groundwork for a draft law that will seek to limit the benefits of state government schemes only to those with 2 children or less. This is also under discussion in Assam. Could panelists share their thoughts on these kind of mechanisms to address population growth? I would have loved to have answered this question, but it's not been asked for me. Who would like to choose to answer this question? Argentina. I told you she's a woman with courage and guts. There you are.
Well, it's simple, Poonam. It's UP, it's not unique. I mean, there are many governments around the world who, of course, when they are confronted either with what they perceive as a large population or high fertility or even low fertility, they tend to invariably think that they can regulate by putting out a policy, because that's what governments do. They put out policies and laws, right? And so I think that it's a normal reaction. However, what I'll say in the short time that we have is that it's important that any government that is considering solutions or strategies to addressing either what they consider or feel is an over or underpopulation, that they learn from, the global experiences. Closer to us, we have a very big example. I will not even mention, everybody knows whom I'm talking about. It doesn't work. Women are human beings with a brain, and they will respond with reason to whatever is before them. So it is shown invariably that when you put rights and choices, And in the rights and choices, it includes availability of service, includes information. And when I say availability, it's a huge basket. I mean, whatever is possible in that country, basket of contraceptives. And then the right information about each method. When we prioritize education, but sometimes education, we would say, oh, it takes time. Just prioritize the availability and the information. You'll see that women respond with reason. Reason meaning that they will look into their incomes, they will look at their needs, either to go out to work or to take care of children. No one wants to see gaping mouths each day crying for hunger. And the list is parents themselves. No parent wants to have more children than they can feed. And so I think we need to think about that. Stop patronizing women and girls. Just put their rights and choices at the forefront. Let's think about the information, the resources, and put their needs as a priority. So that's all. I mean, I'm hopeful, of course, that because India has several experiences, given that it's almost a region in its own. I mean, it's been called a subcontinent for a reason. That is why we have different types of experiences that, you know, states can learn from each other, and we'll be happy to facilitate. I think I can stop there. Thank you.
Great. You know, I mean, you put it so well. As advocates, PFI, this is again a training for us. And, you know, Argentina, we greatly enjoyed, all of us discussed everyone was so proud in PFI in our last staff meeting that they read your article on changing social norms. Perhaps you will write another article on changing social norms amongst educated people about two-child norm. So you really explained it brilliantly. Thank you for taking the charge. I want to request Irfan to share the result of the survey. And we are so impressed that we didn't even remind people, and 94% people participated. Quickly, Irfan, may I request you to share the results? Oh, it's on the screen. So cursive measures, only 1% support. Focus on education empowerment of girls is what, 60% support. They're endorsing what we said. And last mile provision of services for family planning and sexual reproductive health, 37%. And nothing, only 1%. So this is really basically endorsing what we have said and thought. And, you know, we don't have time to sum up this brilliant discussion today, but even if we had the time, I'm wondering how we would have had the time to capture the spirit, the vision, everything that came, but some of the words we will capture in a report, which we will share with all of you. And I really want to thank all our panelists, all our participants for spending the evening with us. But more than anybody else, I want to thank the PFI team, if I may say so. Deepa Nag Chaudhary, who leads the program team at PFI, has really worked hard on leading the seminar along with Irfan and our other colleagues. And I think the quality of PFI's work has greatly improved with Deepa Nag Chaudhary joining us. And I really want to thank her and all our staff members. And good evening. And this was really, you will all agree, a terrific way to celebrate World Population Day.